House File 3166 in front of us, and I think what we'll do is we'll move that bill before us, and she'll have her testifiers come up, but the testifiers are on both bills, and then we'll move the one bill, and then we'll move the other. So Representative Christensen, Representative Edelson, I'm going to have Representative Christensen move House File 3166 before us to be recommended to re-refer to the Education Finance Division. So Representative Edelson, will you present your bill?
Thank you, Madam Chair. And first, I think we had discussed if it would be okay to be efficient if we could have both House File 3166 and 3164 in front of us in terms of efficiency, but we can obviously vote on them separately to move forward.
Yep, so they're both before us. The ones before us, we'll have the testimony, we'll move it, and then we'll move the other one before us. And since you were going to have the same testifiers, then we'll move that bill. So right now we have House File 3166 before us. But your testifiers can speak to both.
Thank you. All right. Well, thank you, Madam Chair. Thank you, committee members. I want to thank the partners for a smoke-free generation that testified before this. Today, I'm glad to speak to two of my bills that are part of a comprehensive solution needed to reverse the e-cigarette epidemic. 3166 requires that we teach one time in middle school, which I think we just heard from our sixth graders, that this has reached the middle school, one time between 6th and 8th grade. And then House File 3164, about the harms of vaping. Because what we're finding out is, to what the students were saying, many students don't fully understand the real implications that vaping has. They have it in cool gadgets, delivery devices that you just wouldn't know that would be so harmful. The second bill is 3164, and this actually, I'm happy to have Cambria, the team before me, Marty Davis, the CEO, created a program at Minnetonka High School, and this bill was developed based on kind of the work that they've done, creating a grant program, but would encourage private partnerships with districts and private businesses first. And if that is unsuccessful, because not every district has, let's say, an Essentia Health or a Fairview Hospital like I do in my district. Not everybody has a Cambria, but Cambria is, as they'll tell you, is kind of expanding out right now. But it would start with a grant of $250,000. I just want to highlight, we have 727 health teachers in the state of Minnesota. We did a survey. I had a working group this summer. We did a survey. 198 of the health teachers responded. That's 27% of our health teachers. We asked them, is formal instruction around health harms of vaping taught as part of your class? 81% said yes. The rest said absolutely not. The other question that was asked, would you be in support of a statewide bill requiring vaping education in schools? 85% said yes. What we know is that schools are on the front lines of dealing with this epidemic. I'm the chief author of Tobacco 21. Representative Baker, I believe that you're my co-author on that. Vaping is an issue, but it's not only an issue for people that are 18 to 21, it's an issue for our middle schoolers. And it's something that I'm happy to have all the testifiers here explain to you a little bit more about why this is such an issue. So Arjun, I could go ahead with my first testifier.
Yes, thank you, Representative Edelson. Go ahead and state your name for the record and proceed.
Good afternoon, Chair and committee members. My name is Arjun Maheshwari, and I am a junior at Edina High School. From school bathrooms to hospital ICUs, the issue of student vaping has grown to the magnitude of a full-blown public health crisis. It has become so ubiquitous that it is nearly impossible to escape. In May 2017, Edina was the first city in Minnesota to raise the tobacco sale age to 21. Since then, 60 other Minnesota communities have passed the same policy. While Tobacco 21 is an important first step, much more needs to be done. That's why last summer I approached Representative Edelson with the bold yet vague idea to address the omnipresent vaping problem that plagues our schools. We assembled a diverse team of students to help draft and advocate for what's now 2 bills as a substantive first step to addressing the problem. With Representative Edelson's enthusiastic support, our student group has consulted with numerous lobbying and interest groups and hundreds of students, principals, teachers, and superintendents across the state. Through the process, we found a vast deficit, like Representative Edelson mentioned earlier, in education surrounding vaping in our middle and high schools. In turn, we have built a coalition of statewide educators and students alike to support these pieces of legislation as a crucial first step to bridge the gaps. Now, some may ask the question, why education? Why schools? The answer is that there's simply a lack of awareness. Students don't know what they're getting into, which is exactly why the only way to initiate further reforms and reactive measures is to have preventative measures, and that starts in the classroom. The only way to empower students to make the right choices for their future is to inform them of the harms in the first place. Ultimately, we need your support and help on these issues. I hope that you will support these two bills as a part of a wide-ranging effort to address youth vaping use. By no means is this a panacea to the expansive and complex problem of student vaping, but teachers, students, and hopefully legislators are united in these bills as a solid first step. If we let this problem proliferate unchecked, we will soon have a generation of smokers. If we do not spend time and money on this issue now, we will be paying a far greater cost in the future. Thank you for standing against the vaping industry and making a difference in the lives of my classmates for generations to come.
Thank you, Mr. Maheshwari, which I probably said that wrong. Representative Edelson, if it's okay if we have your next student come up too, just to get the student voices out there, and then we'll have your other testifiers maybe cut their time a little shorter so that we can get to voting on the bills. Please state your name for the record and proceed.
Yes, thank you, Committee and Chair. My name is Andrew Thompson. I'm a senior from Minnetonka High School. So one of the biggest things we've seen, it was throughout my entire high school career, but more specifically in the last year, is a wild vaping epidemic. And so I've seen students not only in bathrooms in the parking lot, but even to my surprise, in their own classroom using an electronic cigarette or a vape. And so, I mean, that's affecting students in several different ways. They're getting suspended from school, from clubs, from sports. One of the biggest things that we had in place this year was Cambria's They Lie, We Know campaign. And that was a really effective tool within our school. It wasn't in any way condemning students who vape, but it was just merely a tool that allowed students like me to help inform our peers who do use vapes and electronic cigarettes in our school. And it's really to raise up awareness in the best way that we could, not in a condemning way or anything. But it's just students were uninformed. They didn't really know what they're getting into. Quite frankly, students know that it's bad for them, but to what extent, they have no idea. And so that's what Cambria and the They Lied, We Know initiative was just to inform students, get them the knowledge that they do need. And the funny thing is that students that are vaping, they've never touched a cigarette. Quite frankly, I don't think they ever would want to. And because they know that it had a detrimental effect on the generation before them. But they have no idea what they're getting themselves into. And so that's why I think implementing a system like Cambria's They Lie, We Know campaign throughout the state, and then also that's why I'm here supporting Representative Edelson's two bills today, is if we get a campaign implemented in schools, not only like we heard earlier, but in middle schools, but also in high schools, that can create greater education for my peers, for my students who I've seen fall to the epidemic of nicotine addiction. And it would just bring better knowledge, and quite frankly, it would lessen the epidemic that we see today. Thank you.
Thank you, Mr. Thompson. And then if we can have the next two testifiers take less than 5 minutes so we can try to keep in time. We did start about 10 minutes late, so.
Absolutely.
Thank you. State your name for the record and proceed.
Good afternoon, Madam Chair and committee members. My name is Lisa Smith. I am a high school physical education and health teacher at Lakeville South High School. I'm also the president of the Minnesota Society of Health and Physical Educators, known as MinShape. I'm here today to talk with you and echo everything that we've heard so far. I teach this to my kids, and we go all around. And I told my students today that I was coming here, and they're like, I don't vape, Miss Smith. I don't do that. And I said, good, that's good. but we need to make sure your peers don't. So I'm going to go and do this, and hopefully we can, get some help so we can teach everybody, right? So they were so excited for me to come here today to address all of you. So I really appreciate your time. Today in the United States, there are more than 5 million teens using e-cigarettes. We know that, okay, regularly. And this whole generation may grow up with an addiction problem. And these are my students. These are our future leaders. And we really need to help them. This health crisis deserves urgent attention. In my health class, I cover a range of issues while developing my students' health literacy through comprehensive skills-based health education curriculum that includes mental wellness. I do talk about crisis intervention, CPR, nutrition, relationships, safe media use, right? Health, sexual health, drugs, alcohol, and for years and years and years, we've talked about tobacco. We are in need of the best and most up-to-date evidence-based information to share with our youth about e-cigarettes and vaping. We need it. We know that education cannot accomplish this entire goal, but it is so important, and it is the perfect place to start. I echo these students, and I see it all myself as well as an educator, and it's confusing, and we are all at a place where, what are we supposed to do when we see these students in their cars after school? It's after my contract time. I still knock on the window and I look at them, I'm like, really? I don't know. That's as far as I can go at that point. And it's all about relationships. So I get to have that conversation with them the next day at school, so I am lucky for that. But there is an acute need for this instruction, and it's simple for us to integrate this life-saving information in our schools and in my classroom. So I really urge you all, please support this bill as a part of a comprehensive effort to help youth avoid tobacco in education. Thank you.
Thank you, Ms. Smith. Then we have one more testifier, and then we will go on to questions on the bill. Please state your name for the record and proceed.
Sure. Thank you, Madam Chair and committee members. My name is Sarah Lien. I am a marketing director at Cambria, but more importantly today, I'm here as a parent of 3 high schoolers, a freshman, sophomore, and a senior at Minnetonka High School. Last year, a group of us parents at Cambria, we found ourselves discussing the dangers that obviously have been brought here today of vaping and the worry that we had over how it was impacting our kids and, quite frankly, our families. What pushed our anger over the edge, what we've talked about here today, of course, was the fact that Juul and other companies, other big tobacco companies, were downright lying to us and to our kids through ads targeting the youth, making them think that e-cigarettes was safe. As a company, I'm very fortunate that we decided to take action. We quickly launched a peer-to-peer education campaign that we called They Lied, We Know, for obvious reasons. Our goal was to give high school students the tools to educate their peers because, quite frankly, kids, like my kids, they don't want to hear parents like me or other adults talk to them about this. They will listen to each other. We made an impactful video. We created a kiosk environment where the kids could talk about this issue in schools. We launched a website, theyliedweknow.com, and a social media campaign and created an educational brochure. We created a plan to get a group of students on board to lead this change. We educated these kids, and we spent 5 weeks in the school handing out T-shirts, giving quizzes, having the students sign pledge banners, and spreading the word of how harmful e-cigarettes are for their health. Since the beginning of 2020, we also brought our program to St. Peter High School, and then we are quickly moving to Mankato East, Mankato West, as well as New Prague High School and middle school. Our goal is to bring They Lied, We Know to 3 to 4 additional schools before the end of the school year. But unfortunately, Cambria can't solve this problem alone, which is why we are here today and really fighting for additional measures and assistance to fight this battle, including, of course, Representative Edelson's 2 bills that have been discussed today. These proposals will ensure every Minnesota student receives clear information about how the dangers of e-cigarettes are and how life-threatening they can be. We look forward, and hopefully you ensure a platform where this conversation can continue to spread throughout our state. Thank you.
Ms. Lien. And then just to remind members, we have House File 3166 before us right now on the vaping awareness and prevention instruction in middle school. So if we could limit our questions to that, or unless you have general questions for the testifiers, so we can move this bill and then we'll go on to the next one. I have Representative Scott.
Thank you, Madam Chair. And I have a question. Representative Edelson, you mentioned that with the survey that you did this summer, that I think you said maybe 81% of the respondents said that they were doing something, they were teaching something on vaping. And so I'm wondering if you have data on, and I know it's really early in the game with this whole vaping thing, but do you have any data that shows that that education is actually being effective?
Representative Ellison.
Madam Chair, Representative, what we know from the 81 that responded, 81% of the teachers that responded, they said that there was inconsistency. They were coming up, they were doing research on their own. There was nothing that they felt like they were getting a comprehensive package on what to teach their schools. What we know is we've seen since 2016 the number of middle school students double on who are vaping, and we haven't said, hey, schools, let us help you with that. To my understanding, that has not happened. And, we have lots of people trying to figure out how do we deal with this epidemic.
Representative Scott, follow up.
Yes, thank you, Madam Chair. And Representative Edelson, are there other states that have implemented a statewide education program? And if so, what have their outcomes been?
Representative Edelson.
Madam Chair, Representative, that's a good question. This actually came from Student Voices, so I haven't checked into that, but we did do all of our research on making sure that we touch base with everybody here in Minnesota that counts in our state, from superintendents to Education Minnesota to all of this, touching base with health teachers. We know it's a problem here. I don't know if it's been impactful, but I do know that you've had some results with Cambria in terms of changing the culture at their schools. So Essentia Health has also launched a program near Duluth, and they've actually seen some results. So we do have private organizations that are launching programs and seeing some changes, but again, I think it's too early to tell right now.
Okay, Representative Erickson.
Thank you, Madam Chair, and to Ms. Smith, thank you, and thank you to all the testifiers. This has been very interesting. But does your school, or do you also teach that we have 3 chapters of law that make violation of what's happening in your schools illegal? So you teach the indoor you teach the Indoor Clean Air the Indoor Clean Air Act. So students know that's a violation, and then High School League, of course, is a violation. And we also have Chapter 609, which prohibits, it makes it a misdemeanor. So those laws are taught, correct?
Ms. Smith.
Yep, Madam Chair and committee, yes, absolutely, those laws are taught, and students do understand. We have students who are in violation more than they should be. So they are aware, and if they aren't, because they haven't had health class yet, they are quickly learning from their peers, unfortunately.
So Ms. Smith, so there's nothing posted in your school that you know of that would set down these 3 specific chapters in law that would outline for the students that they are doing something illegal and subject to a law enforcement or to penalty. Is there anything
Ms.
that's
Smith?
calling their attention to that?
Madam Chair.
We're going a little far
I
off
just don't know exactly
field,
what I'm
so.
supposed to address you again?
Yeah, you address her.
Yes, Madam Chair and committee. No, there is nothing that I've seen posted with the legal verbiage. There are all kinds of pieces about vaping and, going into the bathroom, as there's a lot of signs going into the bathroom that talk about the health effects, of course, but the legality pieces are not posted.
Thank you.
Representative Edelson.
Madam Chair, Representative, I guess I would also, where is the criminalizing kids with misdemeanors because they've been targeted by tobacco companies doesn't really seem like the solution. I mean, I get that we want these kids to stop, but I don't know that criminalizing kids is the right answer. I think we should really hold big tobacco accountable here for what they've done. I mean, where's that lipstick? I mean, that's not for me. That's not for a 38-year-old woman.
But it is the law.
Yeah, Representative Erickson, did you have a follow-up comment?
No, it is the law. I just wanted to make sure they understood the law.
Thank you, Representative Erickson. Before we move to, is there anybody else in the audience that wanted to testify on this bill? Seeing none, I renew the motion that House File 3166 be recommended for re-referral to Education Finance. Any further discussion on the motion?
Madam Chair,
Yes, Representative Erickson.
so this particular proposal should go to government operations too, because it involves both the Department of Health and MDE. Is it your intention to let Representative Dabney know that this should also be done?
Representative Erickson, Representative Dabney's the only one that's approached me that wants it, because we know there's a small fiscal note coming, but that's a discussion we can have in Ed Finance.
Yeah.
Representative Edelson.
And Madam Chair, for the vaping youth, the e-toolkit that we're mentioning that schools can reference here for middle school and high school actually already exists with the Department of Health, so nothing needs to be created on that.
Thank you. Any further discussion on the motion? Hearing none, those in favor of the motion say aye. Aye. Those opposed, nay. The motion prevails. House File 3166 is recommended for re-referral to the Education Finance Division.